right, welcome everyone. It is Tuesday evening, November 24th, and welcome back to Pump Up the Volume, where we're amplifying the voices of communities and again, pushing back on status quo establishment narratives that always seem to counter the reality. So to start us off with the show, again, as you know, at this point, all of my co-hosts here, Mr. Bill Bartholomew from the Bartholomew Town podcast, Mr. Pat Ford as well, from founder of the Libertarian Party and founder of the Coalition Radio Network. And in terms of Libertarian Party here in the state of Rhode Island, just to provide some clarity there for Pat, and also Mr. Scott Rotondo from the WBOB 990 WBOB. I always get those two reversed. Sorry, Scott. But as always, leading the way. And yeah, great. So all of us are here again. My name is Daniel Munoz. I'm a medical doctor, previous independent gubernatorial candidate in the state of Rhode Island. And it was that journey that brought us really all together in terms of our paths crossing. And COVID-19 has kind of sealed our bonds here. And what we're trying to do this day and every other day since this pandemic started is really dig into what the truth is, what the numbers are showing, and what the future has, not only for the country, but for the state of Rhode Island. Every day, every Tuesday, that is, we start off the show with Bill giving us a rundown of what he has learned over the past week. And then we tend to focus on a topic. I try to, or I would say we try to, switch topics, and we like to invite guests, and we'll be doing more of that in the coming weeks. But in order to kind of get back into the groove of COVID-19 post-elections, we thought it would be important to have some time where we can just really start presenting the questions and formulating new questions to help you start thinking about where we are and where we should go. So as the weeks go on, we'll continue to provide you with more data and more guests that can bring a level of expertise that we on the call may not necessarily have, or perspective at least that we might not have. So that is the framing for today and the rest of the year, I would say, in the coming weeks. But to start us off, as always, Bill, would you like to lead the way?
Sure thing. First of all, happy Thanksgiving to everyone out there. And, you know,
happy Thanksgiving.
Yeah, this week, I had the result of this was great from a content perspective. I had probably one of my most popular podcast episodes. Got a ton of views on Instagram, even did pretty well on Facebook. And that is, and Pat was there as well. I left the governor's briefing on Thursday and walked into my van, sat down, and went right away live on Facebook. And I've been doing this, I've been kind of giving an update. Here's what the governor's announcements were today, kind of a little bit of a ha-ha, make jokes and stuff about it. But boy, did I kind of touch into my heart and soul on this one, because I have never been more confused and aghast by a presentation by Governor Raimondo than I was this past week. You're going to keep Twin River open until November 30th, packing a place in. I had people messaging me photos all weekend long. The place is packed, plenty of elderly people in there, if not mostly elderly people. You're going to keep the state's fundraiser open, while at the same time telling people that they can't sit around a table with more than their immediate family for Thanksgiving. Now, my perspective is that the protections should be focused on people, obviously, in the healthcare field, people on the front lines there, but also retail workers. Now they're talking about Black Friday as part of this pause that they've put in, Governor Raimondo's pause, which starts on 11/30. Black Friday, which is an absolute disgrace in and of itself anyway. One of the most pathetic examples of corporatocracy and runaway capitalism you'll ever find. That and the casino are baked into the decision-making process for this administration. And my tone has completely changed after this last week as far as how I view this pandemic and how it's being managed. At this point, they've lost control of contact tracing. They have no idea where these clusters are outside of Central Falls. They have no idea about the accuracy of the tests that they're presenting. All right. They're going to dismantle small businesses without a significant plan, in a transparent plan, how to keep them afloat. And now they're talking about Black Friday and the casino, keeping them open as long as possible. And then Twin River comes out with this press release saying, wow, we're so generous. We're going to actually, Mark Cristofaldi and everybody at Twin River, they come out and they say, you know what, guys, we're so benevolent. We care about this community so much that, yeah, we agree. We will shut down on November 30th, 2 weeks after we're in a situation where we're seeing 1,300 confirmed positive cases a day. A week after, we're seeing now 300 plus hospitalizations, 16 people in the ICU today. And Twin River, just like many of these other operations, if they cared about this community, they would shut down immediately and they'd pay their employees to stay home. They don't care about this community. And that's what we're realizing over the last few days. That's what I'm realizing. So it generated a nice rant, which went viral. So in that sense, I'm glad about it. But the most important thing is the health and well-being of this community, which right now is in extreme danger. The pause that they've put forth last week, it should be ignored in the sense that you should already be beginning it now, as far as many of the things that they're going to tell you to do on November 30th. And then the things that are absolute nonsense that they're telling you to do, you should just ignore those going forward. So you've got to think for yourself. I know that was kind of a confusing rant right there, but I'm still irritated, and I think most of us are after that presentation last week. It makes no sense.
No, I mean, you're right, Bill. And frankly, the governor's response to one of your questions seemed very intentional in her attempt to undermine the question itself rather than just answering it. And I think that's really the tone of this administration. Let's be clear. I am on the governor's Rhode Island Equity Council primarily because community members advocated for me to be on that council because they know that I will ask the challenging questions just as much as Bill is asking, as well as Pat are asking the challenging questions at the press conferences. And one of the questions I asked when they were presenting the contact tracing data, what seemed clear is that they are understaffed, under-resourced, and they were presenting information that was very high level, right? Meaning we are giving out over 1,200 tons or pounds, 1,200 pounds that is, of food, but not really synthesizing or narrowing it down to what that means for households. How many households are we feeding? And how, at scale, how many households can we feed into the winter? Now, and that's the problem, right? When you allow the Rhode Island Department of Health, and as well as this administration, to throw statistics at you without bringing it down to what that means for your life, your community. And so one of the questions I asked is they were showing positivity rates in Central Falls that were 17.2%, right, which was well over 8% compared to even Providence, when they were showing rates that were primarily dominated in terms of positivity rates within the Hispanic community compared to others. Nevertheless, communities of color as a whole were disproportionately impacting, as we know, in the spring. So they were showing those numbers, but again, the question is basically, some of the claims out there is that because younger people are getting infected, that the increased positivity rates are in a population that is not at as high risk. Those are the claims out there, right? People are inferring that that's true. So I went ahead and asked the question to the Rhode Island Department of Health epidemiologist, and I said, well, what is the demographic shift like? When you think about age, what are we seeing across all of the age groups? And the fact is that across every single age group, there is an increase in positivity rates. That is including the senior population. Okay, so those that are above the age of 65, we are still seeing higher rates now than we saw in the spring. Okay, and that is concerning. Overall, if you look at the peak, I mean the age groups that are that the positivity rates are highest within, or that represent a greatest portion of those positivity rates that are higher, it's between the ages of 30 and 59. Okay, so when you think about 30 and 59, this narrative about young people below the age of 18 that are at low risk of dying, it really, place that narrative to the side and realize 30 to 59 years of age, people have diabetes, people have underlying medical conditions like obesity, lung disease, heart disease, a number of other conditions that affect your immune system, cancers. And so this middle-aged population, or you might fall within the range of young adults, which many millennials fall within that range, right, are in fact still at higher risk than the age group that's 18 or lower. So just put that in perspective, out there. Every age group is seeing an increase, and even the age group within the middle that we're seeing the highest positivity, the highest proportion of that age group within the increase in positivity rates is still potentially at risk for negative consequences. Bill reported this in the spring when we had 30-year-olds that had mini strokes, right? So let's not forget what we saw then and what we can possibly start to see now in the winter. And this is going to be my rant, and then I'm going to hand it off to Scott and Pat, and then Bill can jump back in. But what I need to really focus on here is the fact that you have an administration that says it follows the science. You have an administration that pushed against the now departing president of the United States of America, and yet this governor, who represents the Democrat Party, now has kind of the same words to say, right? The same push for economic gains, relative to protecting the residents of the state of Rhode Island. And so what are we going to do as citizens, as residents, generally as people who live in the state of Rhode Island now? Are we going to accept that narrative somehow is okay now when it wasn't okay in the spring? Are we going to sit back and allow the governor and the administration to pretty much make exceptions for holidays where there could be tremendous economic gain at the expense of communities and families that, if they in fact do test positive, will not only probably not get a phone call from the contact tracing force, but will not receive support to get food, right, while they're in isolation and quarantine, and will likely not get additional support in areas that you might imagine are needed. Like if you are positive, you live in a 600 square foot apartment and you do not want to infect your other family members, where do you go, right? And so there are so many questions that we need to dig into. And yes, there are economics associated with those resources, but in all of the narratives that the governor has put forth to protect the economy, none of those narratives connect the dot that protecting the economy and getting gains here will mean getting resources back to the people who are impacted by COVID and who will need it. I have not seen that bridge. I have not seen that claim. And therefore, I think that this administration continues to neglect communities that are in need and, of course, disproportionately impacted by COVID. So that's my rant. And I just want to say that we need to bring more data to this table. My hope was that that little piece of data that I presented was insightful, and we're going to continue to do that. Certainly, I'm going to take it responsibility in terms of bringing more. So with that, Pat, Scott, either of you can go ahead and jump in. Love to hear your thoughts on this.
Well, if you don't mind, let me just, if you will, follow right ahead with your line of reasoning there, Doctor. We were all treated this weekend to a rather stunning article from the Providence Journal, which talks authoritatively to a 1 in 4 household being, at the point, maybe not of malnourishment, but certainly with simply not enough food to eat, which is a stunning revelation. I'd love to almost have a moment of silence, if you will, if we weren't on live media, to reflect on that here in the United States, arguably the wealthiest planet on the world, we're always told, in the year 2020, roughly 25% of the Rhode Island population simply does not have enough food to eat. How we've gotten to this point could probably take up 3 or 4 shows, but I will just say this. If, in fact, we are embarking, or we've already, let's just say the plane is left, and we are in the beginnings of a journey through a 3 or 4 month period where fundamental nutrition is an issue, how then are we to expect any type of support medically at any level? It's the same. I'm afraid, and my biggest fear, Doctor, is that the same type of under preparation yet high flying rhetoric that accompanied the run up to the school year, where we were preached to, I think Bill will concur every week, about the readiness state of the Rhode Island school system, only to find out that it was all smoke and mirrors. I fear for this state and its ability to respond, both in being ready to vaccinate a state and also provide, as you said, the resources to keep people alive at a fundamental level. People are not eating in our state. And by the way, I'll just throw in a point that was amplified to approximately 25 million viewers of the Drudge Report, as that article was right on the top fold for the last 24 to 48 hours. Good job, Brownie, there. That speaks volumes to the state. We spend a fortune giving away to corporate welfare, and yet we can't feed ourselves. Who the hell would come here if they had a choice. Scott?
Yeah, I think really great points, Pat. I wanted to follow up a little more about Governor Raimondo and her handling of the crisis. I wholeheartedly agree with Bill. Thoroughly disappointed with what I'm seeing to date. I mean, it just appears to me that we have an administration that wants to look like they're doing something. For all the national PR, look, we're doing something. We're trying to get a handle on this crisis, even though they're not sure exactly what to do. And it's almost like the spaghetti thing: throw it against the wall, and maybe something will stick. It is, to echo Bill, abhorrent that Twin Rivers is open, filling the coffers of the state, while small businesses are going to go under. And it's not just a business that goes under. In a lot of cases, that's a family's economic lifeline. That's their life savings is in that business. That's how they feed themselves and house themselves. And my thought would be this to the governor and to her administration: you wanted to be a leader. Sometimes you need to make tough, unpopular decisions. To say that we're going to have a pause after what are traditionally some of the busiest travel days of the year is absurd. Again, you campaigned, you wanted to lead the state. The people of Rhode Island have entrusted you twice now with that leadership. You owe it to us, having been entrusted with that mantle of leadership, to make maybe the unpopular decision. And if it was really about stamping this thing down and stopping just the rampant spread, so we're not having 1,300 plus positive cases a day, then a shutdown should have happened already, certainly before Thanksgiving. That's my 2 cents there. And the fact that there is no coherent plan, again, just echoing Bill's point here, to keep small businesses afloat, when everybody watching and everybody on this show and anybody with a pulse knew there was a possibility of another surge, is ridiculous. It's just about, in my opinion, it's a dereliction of duty as the controller for my company. If there was some basic low-hanging fruit like this that I didn't anticipate and wasn't at all prepared for, I'd be given my walking papers.
Yep. Thanks so much for mentioning that, guys. I mean, it's, let's put this in healthcare perspective now, right? Let's transition this. So the governor's failed. She's not the only governor that's failed. Governors across the country have failed. Federal government failed in its response. Contact tracing efforts are proving to not be successful. If you can't contact trace, if you don't have the staff to contact trace, if you can't support people that are in isolation and quarantine by helping them get food, then what's the point? What's the point? And in the state of Rhode Island, in particular, it's clear that it's failed, and a mobile app wasn't going to help. So now here's the reality. The reality is, based on this decision, based on what we're likely to see this week, 2 weeks from now, it is likely that our hospitals will be overwhelmed. We will not have enough ICU equipment, like ventilators, to support all of the individuals that need support breathing, to keep it simple. And then they're going to have to make hard decisions. Now, I don't think the decisions will be all or none. I think that they'll look for some equipment, maybe CPAP. They'll look for other ventilation devices that normally are not necessarily the primary go-tos in ICU, and they'll try to support people. And so we might have a little more time. But the moment we start putting people in field hospitals, the quality of care, which is not even equitable if you look at statistics, right? Women of color tend to have poorer outcomes than anyone else. We know that statistically. We know that based on history. But when you compound that by now being in a field hospital, having communities that have inequities in healthcare now pouring into field hospitals, the question is, how does that impact quality, which clearly it's going to be lower quality, and therefore how does it impact outcomes in the communities? And so this is where we have to start thinking now. How do we ensure that we provide equitable healthcare in the case of rationed healthcare? And second to that, how do we know how those decisions are being made, because we can't claim to provide equitable care. We can't claim that everyone's being treated equal if we don't know the criteria that's being used to decide who gets the equipment, who gets the supplies versus who doesn't. And in the spring, Bill, as you might recall, we were pushing really hard to find out what is the crisis criteria. What is the criteria when supplies are low by which healthcare providers, or that healthcare providers, that is, will use to determine who gets care, whether it's who gets care faster or just generally who gets the supplies in terms of healthcare supplies. I believe that question was asked again in this last press conference, and very little clarity again was given. Now,
that's correct.
I don't want to make assumptions, right? Because the fact is we could be totally off. But understanding healthcare, being a medical doctor, it's pretty clear that age is going to be a factor. It's clear that age, as well as comorbidities, the chronic diseases that someone's faced with, and age is going to be a factor. And when those decisions are made, this is not a matter of, well, someone is older and they get the supplies out of some honor system. Actually, the reverse might be true, depending on how that criteria is formulated. It could be that preference is given to younger people who have higher chances of surviving as compared to older people. Now, in Italy, we saw examples of that. And my concern with single payer systems across the world has always been that the threshold for ration care is low. That means the amount of pressure that it takes to put on a healthcare system before that healthcare system starts rationing care is very low. And we live in a great country that is a leader in healthcare, a leader in medical equipment manufacturing. And yet we find ourselves now with states like Rhode Island that are deciding or getting to a point where they're having to decide whether they're going to implement a crisis criteria. And that is so frustrating because we have the resources. This administration has had the resources to prepare field hospitals, to invest in equipment and supplies, at best to prevent the spread of COVID or reduce the risk of the spread by making smarter decisions in terms of when to close a state. It hasn't done that. It hasn't invested. And so here we are. So what are we going to do? What are we going to do? If your family member gets into a field hospital, what are you going to do? There's no more time for advocacy at that point. There's no more time for fighting for that person to get a bed in the hospital, for that person to get a ventilator. It's too late. And I hate to be morbid, but this is where we are. This is where we are. And unless communities start to really rise up and call on this administration to shut things down now, to invest now, to prepare for 2 to 3 weeks from now, unless this starts happening, my concern is that we should all start to accept the scenario that I just presented. So with that, I'm gonna again take a step back. Love to get your thoughts, Bill, Scott, Pat, on what you think is going to transpire in the next 2 weeks and what we should be doing now.
Well, you're right. I mean, in terms of, I think, what's going to transpire, I think you being, the expert in the room in the medical field, you're pretty close to bang on, if not exactly bang on. What I like to think about too is the trickle effect of that. So the hospitals will be full, the ICUs, and just an overall lack of equipment. What happens to people who have to come in for non-COVID items like pneumonia, for things like that? Is there going to be space for them? And the answer to that is going to be no as well. So you're going to see kind of this cascading effect. Gosh, maybe even to the people who have serious falls or break limbs and stuff. I mean, where are you going to put these people with the strain that COVID has put on the system? So that's another thing to think about.
There was and please correct me if I'm wrong, but it's my understanding that if you are a CNA or one of, I'll call it the entry-level side of the nursing profession in Rhode Island at a number of healthcare facilities, that you are now no longer allowed to work at more than one. Is that correct?
I didn't hear that one. Phil, have you heard it?
I know what you're talking. I'm not sure if that is entirely accurate. I know it was because people were spreading the virus back in the spring, from one place to the next. But
here's the problem. People who work in the lower rungs of the healthcare field, and by that I don't mean to diminish their work. their work ethic or the quality of their work, but let's just say economically, are grotesquely underpaid. Now, it's funny because I'm going to throw a gentle challenge out, as I always do, to Bill when the word capitalist comes up in a less than complimentary terms. The problem is that not that we have capitalism, that is we have crony capitalism and we have crony corporatism. Those are the words I'll use. And so when I see people like that, and as I've told the audience before, I've worked as a Lyft driver for a couple of years. I was putting 2 kids simultaneously through college. Really, real eye opener as to the economics and the real structure of Rhode Island society, if you will. Because on more than a number of occasions, I drove women, typically my age, at 11 o'clock at night after the shift had gone off, to a second shift at another nursing home facility. And it's really one of the more tragic things that I've ever seen in Rhode Island, because these are women who are of a certain age, great deal of dignity. There's no lack of dignity, hard work, but working at a pace well beyond what should be done by a woman in her 60s. And I'm sorry if that came out. I think people know what I mean by that. For an egregiously low wage, at which point they were spending a couple hours of paid labor a day just simply to get to work. So when I look at that, and I look at how just the inability of both government and our rather heavily controlled healthcare system in this state works, and I look at simultaneously the inability of nursing homes to be compensated fairly for their work, and I look at the fact that the governor now is looking to these same very nursing homes whose bottom line she eviscerated during her administration, who are unable to compete in the private markets because there is no such thing as a private market left in the healthcare system. I just have to say this. Government has failed you. Government does not care. Government has left you behind. And if you are amongst the folks in the most marginalized communities, and by that I mean economically, you're screwed right now, because more regulations are going to come about as to how you work, where you work, and what conditions you work, and just the difficulty of the cases that you work with, while at the same time you will see continued real economic rollbacks, if you will, in the spending power of the people who are doing these jobs. Folks, to your call, Doctor, I'm not sure what to say anymore. We have to look to each other as Rhode Islanders somehow to work this out, because government has failed us. It's absolutely failed us. And we are finding this out, unfortunately, not in a time of just general economic malaise, but at a time when there's a fundamental threat to the health and welfare of literally every Rhode Islander. That's all I got.
Yeah. So here we are. And let's talk about what's going to happen after, right? So we see states now really taking a step back and coming to the realization. When I say states, I mean definitely Massachusetts, along with Rhode Island, coming to the realization that this could possibly be going on until June. Now, if there's a vaccine, like the pilot for Rhode Island is actually a planning pilot. It's not a deployment pilot. So what that means is really they're just trying to kind of coordinate, how would it work if we release the vaccine? What would be the plan, right? So just to talk about that for a moment in terms of the Pfizer pilot that was communicated. So let's say we move forward, we collaborate on this pilot, planning pilot for the vaccine. Let's say we actually get some version of a vaccine put out and specifically given to healthcare workers, high-risk populations that want to take on the risk, given that it's going to be, somewhat of a not so perfect vaccine, about 95% accurate effectiveness, which they're showing now. And let's say that by March, you start getting it really scaling up. You're still going to have some pockets of communities that may not have the vaccine yet until, let's say, June, right? So with that, we are now in June. And at June, what happens? By the time we get to June, at that point, we see the fallout of the actual virus, right? We see the health care outcomes. But that's when we start to really see the economic impact, right? When families that were hurt by the virus try to come back from that hurt, try to access economic opportunities, try to pay those medical bills that they've accumulated, right? When that starts to take effect, when that process starts to happen, that's when we're going to start seeing more poverty here in the state of Rhode Island, across the U.S. We're going to start seeing, I think we're going to start seeing more abuses in industry. I think we're going to also start seeing a heavy push from corporate America to lobby for, if anything, reducing minimum wage. Honestly, I think we're going to start seeing a reversion of a lot of the advances that we've made over the last 5 years to create equity within our communities. And when that time comes, you know what's going to happen here in the state of Rhode Island and across other states. You're going to start seeing the candidates come out for the gubernatorial race, right? Really, right? You're going to start seeing for 2022 people saying that they're going to save Rhode Island. They're going to put money back in your pockets. But all of those people, many of which we know are going to run, are actually candidates, politicians today, and they haven't done anything. They haven't come out with solutions. They haven't pushed back on this administration. They've been in their little pockets of Zoom calls, raising funds to prepare for races instead of preparing Rhode Islanders for the worst of this pandemic, which isn't the third wave, but the fourth, the economic. So when thinking about the next 6 months, possibly, when thinking about the fallout and when thinking about the races that will start to take place, I'm interested in each of my fellow co-hosts really presenting what would be an important question that each of you would ask one of those candidates that's running for governor in 2022 when they're saying that they're going to bring us back from this pandemic.
Ooh, that's a tough question. If you don't mind, I'll go first. It's tough because in a certain sense, it's what we're not sure what we're going to have to come back from. I'm assuming that at that point in time, there will have been a successful vaccination program. So the damage will be largely economic, and it will be severe. I guess I'd ask these people, but part of me says I don't know if we can come back, because ultimately, in order to come back, you've got to have a private sector, and you've got to have an energized entrepreneurial environment. And that's the only thing that brings us back. Government doesn't create jobs. I found great humor in when, all the Trumpers were talking about how Donald created jobs. Yet anyone knows, particularly a Republican conservative, unless you're stretching a point, that government does not create jobs. Private sector creates jobs. So my question would be, is what you would do to peel back the layers of economic bigotry that takes place in Rhode Island to create an environment that is work-friendly, particularly for small business. Because I don't see, given the current climate on a number of levels, I don't see large business coming here anytime soon, unless, of course, as I like to say, we give it away, give it away, give it away. And the problem is Rhode Island is reaching that point where they're just too broke to give it away. You can't give away what you don't have. So I would ask that question. What are you going to do to create an environment where organically, without corporate welfare, job creation can take place?
Thanks, Bill.
I would have go ahead, Bill.
No, go for it, Scott.
Okay, thanks. I'll be quick. I just my question was going to be more about the structure of government. I would ask any of the potential candidates. I think we're kidding ourselves if we think this is the last time we're going to be in some sort of a pandemic or some sort of dire straits like this. Would they commit to partnering with the General Assembly and not just ruling by fiat like we've seen right now? Would they, in a sense, mandate the General Assembly to meet, heck, even virtually, with them to come up with some sort of shared solution to the problem, as opposed to what we're seeing right now with just edicts coming from on high? That's the question I would ask.
Awesome.
Yeah, I agree with that. And I look, there's a lot of different ways to address this. There's the idea of a jobs creation program, which people who are, I guess, big into modern monetary theory are driving the narrative of right now, which would basically be the government creates jobs that are to better society, whether it's people who are public, in I guess landscaping roles for public parks to whatever, teachers, and they pay them a significant wage, with the idea being that there's a job for everybody that pays a significant wage. The government just keeps printing money, and that also raises the bar for small businesses or large corporations to also have to pay a significant wage, because if they don't, then they won't be able to attract a workforce. So there's that school. I still haven't decided myself how I would approach this situation. That's one thing I look at. Then there's also building an environment that creates more competition. And somehow Rhode Island has never been great at that. I mean, just now I was somewhat distracted because Nationalized Grid just put out their first thread calling
Sorry, I
for the...
I hadn't heard that before. Nationalized Grid. That's outstanding.
Yeah, it's a great group. They're working hard, and they just came out with this first thread here. They want a democratically elected public utilities commission rather than state appointed 3-person commission. So, how are we going to come out of this, and how is it going to, from an economic standpoint, going to be? I have absolutely no idea. I'm looking at a lot of things before I can come to that type of conclusion. You know what I mean? Myself right now. But all I do know is that we're in deep trouble, and we've been that way for a while. We need to create an environment that promotes competition, but also make sure that no one's left behind. I don't know how to do that.
Yeah, I'm 100% with all of you, and I would be interesting to see what those candidates will say to those questions. What I would say is, at the end of the day, it is, to all of your points, going to take a community to come together, and that community is the state of Rhode Island. I think it's going to take a mix of volunteerism, of investment in small businesses, and of ultimately, I think, the American spirit really rising up out of this. I think that American spirit does need a step up, right? Maybe a little support in making that first step, and that in fact could be that investment for early stage companies. We certainly know that the state of Rhode Island has a wealth of small businesses, many of them in the food industry, that have been negatively impacted, and so likely will have to find a way to come back. So there is hope, but there is the reality. And I think for us to sustain our hope in this crisis, we need to first come to grips with the reality and know that the instrument of change that we have today is really this: our ability to raise our voices, to really be very clear with what our intention and demands are, and to ensure that every step that we're taking is to protect our family members and our communities and friends. And if we don't do that, it's clear that this administration will not do that for us. So with that, I want to give everyone a solid 60 seconds. Push anything you want up: event, podcast, newsletter coming out, whatever the case may be. Please let the listeners know where they can find you and how they can keep up with what you're doing over the next 7 days. Start with Bill.
Well, I guess a couple of things. Number one, you can keep up with me through the podcast, ripodcast.com, Facebook, btown.stream, Twitter and Instagram at Bill Bartholomew, radio tomorrow and Friday, noon to 3 on WPRO, TV Wednesday night, 7 p.m. on Rhode Island PBS. So there's the big shout out, of course, here every Tuesday night from 7:30 to 8:30. But on the Coalition Radio Network with the great Pump Up the Volume. What a fine program that the doctor and company has built here over the course of COVID. My thing, I won't be in the room tomorrow. I'll actually be covering for Matt Allen while he goes and stuffs his face in the cranberry sauce that he keeps talking about, and rolls around with his pet dog back in Fall River, wherever the guy's living now. So I won't be in the room tomorrow. I'll be doing the pregame and postgame, though. And I know Pat will be in there, and I know Pat will continue to the full court press. I know Hummel will be in there. He's going to keep the full court press, just like you said, Dr. Munoz. Look, the governor's one of the smartest people I've ever met. No, this isn't a personal knock on her. She's trying to balance the small business coalition, the restaurant industry, et cetera, et cetera, et cetera, with the scientific and medical expertise. which is also putting out conflicted messages. That I don't remember his name. The guy from Brown, what's his name? The guy that Steph Machado interviewed. He's saying it's okay to have in-person dining and in-person schools. So there's conflicted messaging everywhere. But the bottom line is that we need leadership right now from the governor that she hasn't displayed since day one. And I mean that literally, back on day one, that type of leadership. The room, when she walked into that first press conference, it was a Sunday morning. I think it was March 13th. I woke up. I had the message to get to the Department of Health. Turned on the radio on a Sunday morning. Bill Haberman, WPRO News. You knew something big was coming. You knew something titanic was about to hit. And when the door opened up and the governor came into the room and addressed all of us reporters and the state as a whole, the time-space continuum shifted, and she became a presidential-level speaker and leader for a very short period of time. She's lost that. She needs to find that tone again, and it needs to happen tomorrow.
All right, I'll go next. Listen, you can find me here at facebook.com/The Coalition Radio, on the Mighty Mighty Twitter at Coalition_radio. And of course, you'll see links to our YouTube page. I'd ask everyone if you could take a moment and just follow us and like us there. We run programming here 3 nights a week. We're going to gradually amp that up as we go along. There's some outstanding programming tomorrow night, a show called Ramp, which is dedicated to the folks who are physically challenged, and just an amazing resource that Tina, our host, is, and just has literally had a who's who of guests ranging from the Secretary of State to Congressman Langevin on all about getting resources out to people who really lead their best lives and full lives, and people who want to amplify that. So we're grateful to have the Pump Up the Volume on here every week, and it's really just a beginning to what kind of programming you're going to see in the new year.
Awesome. Thanks, Pat.
All right, and you guys can follow me on 990wbob.com every Monday night from 8 to 9 p.m. The past casts are all up there, and I have a very special guest coming up who I think some people in the room know very well this coming Monday to talk COVID. And, I usually I shoot from the left. I usually have something to get people on the left and on the right and on the center to think. You can find me here on Facebook at Scott Rotondo, the king of originality. So you can find me on Twitter at Scott Rotondo as well. And I welcome all sorts of debate.
Awesome. Thanks, Scott. Looking forward to being on this show next week as well. So I want to thank all my co-hosts here. These are great friends, great people, and really trying their best to give all that they have to find truth and to share that truth. And in a time when there's a lot of disinformation, it's important to elevate individuals that in fact have some objective truth to share. So please follow them. They're all very responsive to inquiries, so I'm sure that they'll get back to you if you have any questions. I certainly will. I want to thank you all for joining the show again. Today was a bit of it's always a serious tone, but today there may have been a heavy amount of information, right? A heavier tone. And I just want you all to know that it is very intentional. We are in scary times, but just know that we are here to fight for you, not only with words, but in action. And we, beyond the scope of Pump Up the Volume, are actually out there doing the work. We are out there collecting information. We are out there doing contact tracing. We are out there trying our best to help healthcare systems to expand their resource capacity and their ability to support communities. So please know that we're doing our part. And I'll leave you with this. What can you do? What part can you play in this crisis and supporting your communities? The first step is to protect yourself and your family. But in that second step, what else can you do? So with that, join us next week on Pump Up the Volume, where we're amplifying the voices of communities, challenging the status quo, and bringing you information that the establishment does not really want you to know for whatever reason. So thank you so much. Hope you have a good evening. Stay safe out there. Much love. Peace. Thanks, guys. Have a good night.
Good night.
Good night.